Hi there. I'm Dr. Fred Rouse, the Real Money Doctor, and I want to get this quick update to you on the COVID-19 and what's happening in the financial markets and really how it affects you. I first updated you back on February 26th and again on February 28th, regarding what's happening. This is not fake news. In fact, it's probably pretty much the only news that's over the airways at this point in time. I want to touch base on three very specific areas. One, on health. Two, a financial update. And three, what's next. Okay. First, let's talk about the health. There are many people out there that have a good handle on what's going on. You should get factual information. The best place to do that is from the CDC. They handle all the health issues, and you'll be able to get factual information from them personally that'll affect you personally. That's probably the best place to go. Now, the internet is not the good place, okay? The news media is generally not the good place. Get it directly from the CDC. Now, it's important to understand this is spreading exponentially at this moment in time. There are more cases than we know about because the testing has been so poor and so far behind, so we really don't know what's going on. We'd like to know, but we just don't, okay? The federal planning and response have been exceptionally slow and uncoordinated. This is due in part because in the first 2 years of the current administration, one of the offices that would handle this, that was put in place the last emergency, was dismembered. Okay, they shut that office down. And so the response is slow and it's been piecemeal the whole time. Right now, politics is seriously getting in the way of science. The two are clashing big time. And it looks as though the administration is starting to come around and lean more towards the science, but we'll see what happens. Without a doubt, things are being bad now, almost to the point where they were almost worse than Katrina when that happened. The federal response has just been that bad at this point in time. The states and individual organizations have been stepping up big time with really strong measures. All sports have been shut down. Every agency that handles sports shut those things right down. Okay. Public gatherings are shut down. Theme parks, any meetings in communities and industry conferences are pretty much shut down. Conference theaters, weddings have been postponed. Most schools have closed where possible. And if not, chances are they're going to be closing sometime soon. In fact, it's so bad, the Supreme Court actually postponed oral arguments due to the health crisis. Okay, the last time they did that for health crisis reasons was back in 1918 with the Spanish flu. So a lot of things are going on. Also, it's important to remember that for every confirmed case, there can be as many as 10 undiagnosed cases that are running around constantly infecting everybody else they come in contact with. Now, it's not there yet, but it's getting much, much closer to a national 14-day minimum shutdown to try and restrict the virus and to try and define the extent of the problem. Right now, nobody actually knows what the problem is. They know the thing exists, but they don't know how large it is. Okay? Because the lack of testing, okay, they can't define it. So that has to occur first. And there's a real good chance that sometime relatively soon, there's going to be a national 14-day minimum shutdown. Now, the other problem with the health situation is that the hospital capacity is really not ready to handle the influx of problems. In fact, the supplies that the hospital has are nowhere near what they're going to need. And that problem is going to be mushrooming as this thing grows, basically in the next 2 to 3 months, because it's going to be about that long. Now, people are going to be dying. Without a doubt in the world, some people are going to die. Okay, are you going to be one of them? Probably not. Okay, there's a real good chance, though, that if you just get sick, it might be a mild, maybe a heavy case of the flu. But in the meantime, okay, how many elderly people do you come in contact with? Your parents, your grandparents. These are people that are seriously at risk of dying. Okay, now, for now, okay, catch your breath. Don't go crazy. Wash your hands. Cover your mouth anytime you cough and sneeze. Those particles can shoot out almost to 12 feet away. Okay, stop breathing on food. Watch your social contacts. Okay, trying to restrict them as much as possible. Health-wise, you're probably going to be okay. Without a doubt in the world, probably for most people, you're going to be okay. However, for the financial side of things, okay, there is a serious financial and social impact that almost everybody is going to notice it. without a doubt in the world, you're going to get affected, whether you're sick or not, whether you end up sick or not. Socially and financially, this is going to affect you. Okay? It's going to be a serious economic fallout. Right now, okay, there was over a $1.7 trillion of wealth lost already in the stock market. $1.7 trillion of money just gone in weeks. From March 17, 2020, okay, the stock market dropped 12% in just one day. One day. It closed over 29% off its February highs just a month earlier. 1 month ago at record highs, and now back to 2017 lows. It's an amazing thing. And again, things happen every 7 to 10 years, and I've been trying to tell people about it, but they're on that sugar high with the market goes up and they think, oh, we're going to be fine. Well, surprise, things happen. Now, my students understand support and resistance level, and they know exactly what that means when a major support level is broken. Okay, and it has been yesterday, major. Now, a lot of people live from paycheck to paycheck. These folks are already experiencing serious financial problems. There will be, without a doubt, increased personal and business bankruptcies. Anyone that's currently associated with tourism and hospitality industries, they're having problems, and those problems are only going to increase. That includes the states. Okay, a lot of states base their revenue on those two industries. Nevada and Florida come to mind specifically. Cities like Las Vegas and Orlando, okay, and any beachside community, they all depend on tourism. Okay? And when that tourism drops off, the tax revenue drops off, the state's going to be in a serious problem. Okay? These problems are going to persist for a while because the extent right now of this problem is yet to be defined. Now, people that had a little bit of savings are going to be quickly depleting those savings. Individual workers are going to get crushed. Not everybody, but some individual workers on the lower end of the pay scale are going to get crushed with this. If they had a little bit of savings, a couple $1,000, $5,000 maybe, okay, that's going to get depleted in the next couple of weeks with no problems at all. Okay, retirement accounts that already lost money, okay, they're going to get tapped, okay, without a doubt in the world. As things go on, they go through the liquid cash, then they start hitting retirement accounts. So in 2-3 months, okay, those retirement accounts that were already hit because of the financial crisis, okay, we're going to get drained even further. The U.S. government is coming close, not quite there yet, but we're close to committing $1 trillion in financial stimulus with all the combined bills that they're currently under consideration right now. Now, there is no doubt that this will affect your lifestyle and your money in the coming weeks and the coming months, mostly because the size of the actual problem has yet to be defined. Okay? That could be another month, maybe 2 months, maybe 3 even, hopefully just a month or 2, but it could be as many as 3 months before they actually get to define the problem. How many people are actually infected? Okay, and as the testing comes a little bit more online, that will be improved a little bit. Okay, now it's not all bad news. There is some good news. What do you do next? Okay, the good news is that people that do have a plan B in effect are going to be better than those without one, without a doubt in the world. If you don't have a plan B, now is definitely the time to put one into place. Just like the Black Monday of 1987, Y2K, the Ebola, anthrax, and 9/11, most everyone will survive. At some point in time, okay, this is just going to be a memory. Unpleasant, but it will be a memory. And just like every other thing that happens every 7 to 10 years that caused the market to crash, okay, it'll go by. People will survive. They always do. Okay. Now, are you going to go bankrupt? Are you going to die? Probably not. Okay. But, put a plan B into effect without a doubt in the world. Be safe. Okay. Know that, it's difficult to think about it. It really is. But enjoy the journey through this, because when you get tested, you get stronger on the back end of things. As a nation, we got stronger after 9/11. As a nation, our response improved considerably after Y2K and Ebola and anthrax. Okay. After the Black Monday of 1987, major institutions got some correction and some direction with new legislation that strengthened the financial markets. Sadly to say, some of that's been stripped out, but we'll see what happens. But for now, Try and take some time. Take a breath. You will survive. Without a doubt in the world, you will survive. You'll come out on the other side of this thing. You're not going to be 100%. However, you will be stronger because of what you went through. Now, if you happen to need some help with Plan B, give us a shout. drrousenow.com. Go on a site and I'll see what we can do. We can help some people. We can't help everybody. But for now, be safe. Thank you.